Hi. So the most important thing when operating is how you stand and how you address the table. I'd like to take you back a little bit. Have you ever considered why a counter is the height it is? Well, that's very simple, because it reflects the median height of the population to enable your upper limb to function in the proper way. Just think, if a table's too high, your elbows go out and your shoulders are fixed, limiting the movement. If your table's too low, you end up hunching over and bent. Either way, that is putting a lot of strain on your back and the neck. Indeed, there are studies to show that surgeons, and cardiac surgeons in particular, have a lot of problem with osteoarthritis in the neck because we're bending over, inclining our heads and putting a lot of strain along the back. I remember my anatomy teacher at medical school discussing the functional anatomy of the upper limb. For the shoulders to work, to enable your upper limb to work properly, they have to be relaxed. The functional angle of the upper limb is a slight extension at the elbow with your fingers plantar flexed. I often think this is a bit like a Thunderbird's puppet walking around. And it is in that angle and in that position that your upper limb, your fingers, your elbows and your shoulders can work properly. It must be remembered that your shoulder is a very clever joint. Think of it this way: an MFI cupboard or a flat pack is sometimes difficult to put together because of the different angles and different positions your arm has to be in. But your shoulder enables your elbow and lower arm to get into a position such that wherever it is, you can effect pronation and supination. So the first thing to do when approaching the table in the theatre is to look at your posture. And the table height is important. That's why in our wet labs we have adapted our tables as ironing boards, and you have one at home to do exactly this. It's important that your table is at a height to enable the upper limb to function properly. That is, as I said, relax across the shoulders, flexion of the elbows and flexion of the fingers. Remember, the patient is on the table too, and the height of the table is usually at the level of your anterior superior iliac spines. So once you're comfortable and the table is the right height, you can start operating. Now, it's very important for a trainee and a trainer where there's a difference in height that you set the table for the trainee's height and not the trainer's. If there's a big disparity in height, one way you can address that while maintaining your posture is think about how a giraffe actually drinks its water. What they do is actually spread their legs out to take your height down to enable you to get to the right position. Remember, the posture and the position of the table is also affected by the tilt. And simply tilting the table can actually give you that few degrees of rotation necessary for you to effect the perfect angle for your needle to pass through the tissue. That is posture. The next important is address. You probably play sport, tennis or squash, or observe people playing tennis or squash. You'll note that on a forehand and a backhand, people stand differently. Likewise in surgery, there's a forehand stitch and a backhand stitch. And very often we are stitching around circular objects. That necessarily means that in the course of our stitching, we are going from forehand to backhand. Now, there's one very, very difficult stitch in surgery. Can you guess what that is? It's very simply this. It's very difficult to stitch in to your shoulder. The angles and the position makes it very awkward for you to rotate the needle. This is going to be different for everybody depending on their height and body habitus. But when you find yourself in this position, it is likely you're going to need to change your dress to a backhand. Note that I've moved the weight from my right leg and I've now changed it to my left leg to affect a backhand, a bit like a cricketer, a bit like a tennis player, a bit like a squash player. Sometimes it's a little bit more subtle than this, and it's very simply affected by changing the weight on your legs. Simply by changing my weight to my right leg only, my pelvis tilts, my shoulders tilts, and gives me that subtle angle to affect a rotation. Note as I change my weight to my left foot. My pelvis tilts again, and the angle is changed to enable me to affect the rotation of the needle. Which brings us on to the next important principle, and that is rotation. All needles are actually made on a circle, and they are designed as such that they need to rotate through the tissue on that circumference all the way through its passage. That is going into the tissue and out of the tissue, such that if you take a tangential slice through the passage of the needle through the tissue, you'll see a perfect hole, and that is the hole in which the suture sits. Now, if you take your suture, a needle, through the tissue inaccurately, you end up with an elliptical hole, and you can see there a space between your suture and the hole which is made by the needle. Now, in cardiac surgery, this is very evident by your anastomosis leaking and oozing. In general surgery, this could be a microabscess. To effect a perfect rotation of the needle through the tissue, it's important that you align your needle properly. And it's very easy to align. The perfect angle is 90 degrees. And if I asked you to look at the door, you would tell me very clearly if that angle was more or less than 90 degrees, the majority of the time, even if it was a few degrees out. This is the secret angle for rotation. To enable your needle to pass through the tissue cleanly, it is important that your needle is at 90 degrees to the tissue, not only across the tissue, but 90 degrees into the tissue. I don't know if you sew buttons on a shirt, but to actually make the sewing of a button on a shirt easier, it's important your needle goes through at 90 degrees and comes out at 90 degrees, because the whop and weave of the tissue is a bit like that. If you come in at an angle, you'll find the needle having difficulty passing through the tissue. Whereas you go at 90 degrees, it'll pass through the tissue easily. So when you think about stitching in general, if you align your needle at 90 degrees to the tissue, rotate the needle back so it's 90 degrees into the tissue, and rotate it forward and sort of relax the needle through the tissue, you'll find it'll pass through on that circumference, leaving a perfect hole with no space for the suture, and also everting or inverting the tissue cleanly and accurately. This gives you a framework on how to think about how you stitch. Very simply, you line your needle to what you're going to stitch, and then take it back from that alignment and how you line your upper body and how you line your posture to enable that rotation. Now, to help you with all of this, the exercises that we introduce and the stitching that we're going to introduce to you need to be done with your non-dominant hand behind your back, maintaining your lumbar lordosis. I do recall my trainer many years back actually using a sterile bandage to bandage me to a drip stand to ensure that I stood up properly during an operation. A 3, 4, 5, 8-hour operation could be very strenuous and very difficult if you're not maintaining your posture. That needs to be maintained throughout the operation, and you need to be aware of the height of the table, the angles, your body position to affect the perfect rotation of the needle through the tissue. Remember The secret angle all the time is 90 degrees across what you're going to stitch and 90 degrees into what you're going to stitch to effect a perfect and clean rotation.